Hi, I'm Dr. Megan Close from Duke University, and I'm here to talk about the differences in pregnancy planning for men and women with rheumatic disease. So first off, we're going to start with men. Men are really pretty straightforward here. These are the ACR guidelines about medications for men that can be used safely while the man is trying to conceive a pregnancy with his partner. As you can see, the majority of medications are over here on the side of strongly recommend continuing or conditionally recommend continuing. And we really actually only have two recommendations that medicines be stopped prior to the man trying to conceive, and that is cyclophosphamide and thalidomide. A lot of medicines have very limited data about their impact on a pregnancy if a man is taking it. However, it's just worth knowing that throughout the entire world, there are really not birth defects that have been identified that are due to a man taking a medication. So the message to men, for the most part, continue taking your medications. It should be totally fine and very safe for you to continue taking your rheumatic medications while you are trying to conceive a pregnancy with your partner. Now for women, the story is a little bit different and can be definitely more complicated, because our rheumatic diseases can impact pregnancy itself, so when women have increased disease activity, particularly with lupus or other kind of connective tissue diseases that involve internal organs, the pregnancy can be really particularly high risk for the woman, but also for the baby. So it's important that we time pregnancies to coincide with periods when the disease is quiet. In addition, there's a lot of different medicines we use for rheumatic disease now, some with really good safety data, some with data showing us that they're risky, and some medications without a lot of data. So it's a little bit more complicated to figure out what to do. In response to this, we have actually created a couple of websites I'm going to show you. The first is called reprorum.duke.edu. This is free to use, and we encourage you to go and take a look at it. It has a lot of great information about pregnancy planning and pregnancy management for women with lots of different rheumatologic diseases. We have created discussion guides to really help you talk through the decision-making process with women with inflammatory arthritis in particular. It includes information about the various medications that we consider compatible with pregnancy, the medicines that aren't compatible with pregnancy, which is in particular for inflammatory arthritis, methotrexate, but also mycophenolate and cyclophosphamide, as well as potentially leflutamide, and maybe even some of the new small molecule drugs, as well as a little bit of information about what to do with all of these amazing biologics we have today, for which we have really limited data about pregnancy. In addition, we created lupuspregnancy.org, which also includes a lot of information that you can use with your patients. We also have a patient pregnancy planning guide there that I use often in clinic to actually talk through the pregnancy planning decision-making process with our patients. So for men, the message is simple: go forth and multiply. For women, it's a little bit more complicated, but the vast majority of our patients can really have very successful pregnancies. It just takes a little bit of planning and timing and adjustment of medications for the large majority of our patients to be able to build the families that they want. Thank you so much.